Okay. Hi, I'm Nicole. I'll be your student nurse today. Can you tell me your name and date of birth?
Courtney Bonnell, 5/30/92,
All right, and can you tell me what year it is?
2020.
All right, and do you know where you are?
Yes.
Where are you?
Doctor's office.
All right, and then who's the president?
Donald Trump.
All right, so you are alert and oriented times 4. Do you have any current medical diagnoses?
No.
No? Okay, and then can you tell me a little about your family history and your past medical history?
A history of heart disease, breast cancer, but I don't have anything wrong as far as I know.
All right, perfect. And then do you have any allergies?
Not that I know of.
Okay, so none to food or medicine. Are you currently taking any medication?
No.
And then can you tell me a little bit about your immunization history?
I have them all.
You have them all?
Have them all.
And then do you currently have insurance?
Yes.
All right. Can you tell me a little bit about your sleep pattern?
I get about either 8 or less hours of sleep every night.
Okay. Are you well rested when you wake up in the morning, or are you still tired?
I feel fine when
Okay.
I wake up, yeah.
And then do you have any relaxation activities that you like to do before bed?
No.
No? Okay. And what do you like to do for leisure and recreation activities?
I take my dog Lucy for a walk. We watch TV.
And then do you have any problems performing any of your daily living activities like cooking, cleaning, taking your dog for a walk?
Nope.
Perfect. Are you currently experiencing any bladder problems or pain?
Nope.
How about any bowel problems or pain?
Nope.
And then when was your last bowel movement?
Today.
Okay. Do you know around what time?
No.
Oh, that's okay. So what's your diet like? What does it consist of?
A lot of really simple, quick meals.
And then do you typically eat all of your meals, or do you usually have leftovers?
I have leftovers.
What percentage would you say leftover?
Most of them. Most of it, yeah. I probably eat like 1 serving, and then the rest I save for leftovers for lunch and dinner.
And then do you eat, how many meals a day do you eat?
2.
2? Okay. Do you have any food preferences?
I like Mexican food.
Okay. And then what is your height and weight?
5'7.5", 5'8", depends on the day. And like 160.
Okay. Then what is your attitude about yourself? Do you feel like there's anything that you can change or that you want to change?
Gosh, no.
No?
I would never change myself.
Perfect. So no desire for that. Are you currently experiencing any pain?
Nope.
And then when was your last period?
Last month sometime.
And do you have any children?
Nope.
Are you on any type of birth control?
Nope.
And then do you perform the monthly self-breast exam?
Whenever I can remember.
And then how is your satisfaction with your sex life?
It's good.
What is your occupation?
I am an X-ray tech.
Have there been any recent changes in that role?
No, we're more cautious about what we do with our patients, but otherwise, nope.
So you'd say you're pretty comfortable in your role?
Yep.
All right. What is your marital status?
Single.
And what would you say your family structure looks like?
What do you mean?
Like in your household, do you have, like, you don't have any children, but would you say like you have pets?
Oh, I just have pets. It's just my dog and me.
And then for your family structure, your parents, siblings.
I have parents. I have a younger sibling, an older sibling.
Okay. And then how do you cope with stress?
I like to take my dog for a walk, listen to music.
Okay. And then do you, what would you consider your main sources of stress to be?
Ooh, definitely my dog and work.
And then who do you or what do you view as your support system?
My family and my friends.
And do you have any religious, would you consider yourself any more religious or spiritual? Or about the same?
About the same.
So do you have a religion preference?
I'm Catholic.
Okay. And then what are your cultural beliefs and practices?
Just to be a good person.
good person. And
Yeah.
how do you practice those values and beliefs?
I just try to be nice to people that I meet. Just, you never know what they're going through.
Do you have an advanced directive?
No.
And then, if it came down to this, what would your resuscitation status be?
Oh, everything. I want full code, CPR, and all the drugs, tubes, yeah, everything.
And then, what would you say your overall satisfaction with life is?
I'm satisfied with my life.
Okay. So we're going to start the assessment part now. That was just a couple of questions. We're going to first start off by taking your blood pressure and your oxygen saturation. So if you could just hold out one of your arms. I'll try to make this quick for you.
This is Lucy.
This is Lucy. This is your dog.
She's my emotional support dog.
The cutie. Just let me know if this hurts at all, okay? It shouldn't hurt, but if there's too much air or something. Alright, your blood pressure is 114/74, so that's wonderful. And then we're going to put this little clip on your finger. It's going to tell me your oxygen saturation. Alright, that's 98%. So next up, I'm going to just assess your skin and nails first. So if you just put your hands out. Your skin is smooth, light pink. You do have one slight cut on your hand. Can you tell me where that came from?
It's for my dog Lucy.
Your dog?
Yeah.
It looks like it's almost healed, so that's great. Smooth, pink, no lesions, present a couple freckles. I'm gonna do your capillary refill, so I'm just gonna push down on both of these fingers and look for the blood to return. Capillary refill is less than 2 seconds. I'm going to do your pulse now. This is your radial pulse. It's even bilaterally, and it's a 2+ in both wrists. Then I'm going to do your brachial pulse real quick as well. Even bilaterally, also 2+, so that's great. The temperature of your skin is warm. There's no moisture present. We're going to practice range of motion real quick. So what I'm going to have you do first, we're going to work on your shoulders. So if you could stand up really quick. Your shoulder one, if you can extend your arms fully behind you. Perfect. And now can you put your hands above your head and touch them? Perfect. And then can you put your hands behind your head and interlink your fingers? Great. And then put your arms behind your lower back. Just like that. Perfect. You can go ahead and sit back down. We're going to do your elbow next. So have your arms out. Can you bend them up towards you and then fully extend back down? Great. And then put your hands out as if you have little knives as your hands. Can you turn your thumbs inward? Perfect. And then can you go back to the original position? Can you turn your thumbs outward? Perfect. So you have full range of motion there. Now we're going to test your wrists. So put your wrists straight out. Can you point your fingers to the sky? Perfect. Now can you point your fingers to the ground? Great. And then can you move your wrist to the left or your fingers to the left? Can you move all your fingers to the right? Great. Then we're going to do your hands. So can you spread your fingers out as wide as they can go? Make them into a fist. Put all your fingers together and then have your thumbs out. And then can you bring your thumbs in? Perfect. So range of motion looks good. It's 5 out of 5. You can put your hands down now. So next I'm just going to assess your scalp and your head. Let me know if you feel any type of tenderness or pain, okay? There's no lesions present, no masses or bumps, so that's great. And now we're going to do your eyes. So I'm going to hold this pen light out in front of you. I need you to keep your head straight, and then just follow this wherever I move it. But remember, keep your head straight, okay? Don't move your head. Perfect. You have all 6 fields. And next, the room's already kind of dim, so I'm going to flash this. I want you to look over at this pen over here. You might have a bright flash of light in your eye, okay? Just going to check your pupils. Both are equal and reactive. And then watch this pen as it comes towards your nose, okay? Follow it in. Perfect. So your pupils are equal and round. I've washed my hands now, and I'm just going to go ahead and touch the outside of your eyes real quick, pop it around there. Your sclera is white, your irises are hazel, no lesions, drainage, nothing like that is present, so that's great. Next up is your nose. So what I'm going to do is I'm going to plug one of your nostrils, and you just blow out the other, okay? All right, both of your nostrils are patent. Then just pop it around. Do you have any pain or tenderness in the sinus area or anything?
Nope.
Perfect. Now I'm going to look at your ears. Any pain, tenderness?
Nope.
No masses, lesions, anything like that. The skin color is even throughout, so that's perfect. Next, can you open your mouth for me? I'm just going to look at your gums and your teeth. All teeth are present. Your gums are pink. You can see all your tonsils, your tongue pink as well. Can you lift your tongue up for me? Perfect. Can you swallow for me real quick? All right. Doesn't seem like your trachea is deviated. So next we're going to move on to your neck. We're just going to go ahead and palpate around here, okay? Let me know if you feel any type of pain. No tenderness. Okay. Palpate your trachea. Trachea is midline. So now I'm going to palpate your carotid artery, okay? Just swallow normally. Perfect. It's even bilaterally. That's perfect. Okay, so next we're going to do your range of motion again. Can you put your chin towards your chest? And then look to the sky. And then can you get your left ear to your left shoulder without moving your shoulder? Okay, can you get your right ear to your right shoulder? Perfect. The range of motion is good. So next what we're going to do is we're going to check the back part of your lungs, so your posterior chest. So I can come this way. So the skin is still the same pinkish color. There's no lesions present, anything like that. Can you breathe for me? Okay, so it's symmetric bilaterally, then there's no use of accessory muscles, no heaving, no dyspnea, anything like that. Do you have any trouble breathing or anything?
Nope.
All right, perfect. I'm just going to go ahead and listen to your breath sounds. Every time my stethoscope moves, can you take a deep breath for me, okay?
Okay.
Take a deep breath. Take one more. Another deep breath. Another deep breath. Do one more. Another one. Alright, so your breath sounds sound normal. They are vesicular breath sounds, so that's great. And now I'm going to come to the front of your chest and kind of do the same thing. I'm going to palpate up here for lesions, masses, that stuff. Any pain like that? Okay. And then any pain, lesions. Perfect. There's no masses, no lesions present. So what we're going to do now is we are going to, again, listen to your breath sounds. So just take a deep breath every time the diaphragm of my stethoscope moves, okay? Alright, there's no adventitious breath sounds, so that's great as well. I'm going to just pinch a little bit of your skin right here to check your skin turgor. It was immediate recoil, so that's great, means you're well hydrated. So you can go ahead and lay back now. Let's see you as well. We're going to go ahead and look at your heart now. We're going to inspect the pericardium. There's no pulsations or heaves present, so I'm going to go ahead and palpate. You have a nice strong heartbeat going on. So next I'm going to go ahead and inspect and palpate your apical pulse. Alright, and now I'm going to go ahead and listen to it real quick. My stethoscope. You can breathe normally. It's an even rhythm, so that's good. Strong heartbeat. I'm going to go ahead and start at your aortic. Going to breathe normally. Pulmonic. Herbs point. Tricuspid. Your mitral or apical pulse. Goes with my diaphragm. All of them sound very well. Even. No murmurs, nothing like that. Alright, your heart sounds good. So next I'm going to assess your abdomen. Your abdomen is rounded, same color as the rest of your body, the skin color. And there's no pulsations at your umbilicus. That's great. It's symmetric on both sides, also good. I'm going to go ahead and oscillate it starting at your right lower quadrant. We're oscillating for bowel sounds with the diaphragm. You have active bowel sounds in all four quadrants, which is perfect. So we're going to go ahead and percuss just to see if there's any masses or anything in there. All good. We're just going to go ahead and palpate. Let me know if you feel any type of tenderness or anything, okay? Any tenderness? Nope. No masses are present. So I'm going to go ahead and palpate your spleen first. What I'm going to need you to do is I'm going to stand over your right side to the side. I'm going to go ahead and reach over your abdomen with my left hand, and then I'm going to put like under your lower ribs, okay? I'm going to put my right hand here, my fingers facing up. I need you to just take a deep breath in, and then you can exhale, okay? One more deep breath in, and exhale. Okay, so it's not palpable, that's perfectly normal. Next, we're going to palpate your liver. Okay. And do the same thing again, just on your right side this time. So I'm going to have my left hand here, my right hand right here. Go ahead and inhale. And exhale. Take another inhale. And you can exhale. It's not palpable, which again is just fine. And then next I'm going to do your kidney. So we're going to start with your right kidney, and then I'll go to your left one. So I'm going to do the same thing. I'm going to put my hand right here, and my right hand right here. So just go ahead and inhale. And then when you exhale, hold it at the end of the exhale. Okay. And I'm going to do the left. Okay, kind of the same thing. You can go ahead and inhale and exhale normally. When you exhale, hold it for a second. Alright. Neither of your kidneys are palpable, but that's also okay. It's completely normal. So I'm going to look at your lower extremities really quickly. I'm going to go ahead and inspect your legs first. The skin is the same color as the rest. There's no blue Present, so no cyanosis. Good blood flow. There is no edema present. I'm going to go ahead and push on your legs. It's a 0, so no edema. I'm going to go ahead and I'm going to palpate your arteries, so your posterior tibial artery. It's even bilaterally. It's 2+. I'm going to get your dorsalis pedis pulse as well. It's also 2+, and it's even bilaterally, so that's great. I'm also going to do your capillary refill on your toes. I'm just going to press down on your toes real quick. And wait for, see if the blood comes back. It's less than 2 seconds, so that's wonderful. You can, the temperature on your legs, it's warm. There's no cool, so that's good. And then the hair distribution is even. Nail bone color is pink, same as your fingernails. And then, so you can go ahead and sit up. Do you have any questions for me?
No, I don't.
No? No. All right. Well, your provider will be in shortly. If you have any questions in the meantime, just let us know.
All right, thank you.
Thank you.